Welcome everyone again for another lecture in GI system, which is about the anatomy of the pharynx. First of all, we know that the pharynx is a muscular tube. This is the pharynx, as I mentioned, the muscular tube lying behind the nose, oral cavity, and behind the larynx. That means it's not a small part that we can see in the mirror. No, this is just the oropharynx, but still we have two parts of the pharynx that we cannot see, one behind the nose that called nasopharynx and one behind the larynx called nasopharynx. So we have three parts. The pharynx started from the base of the skull, as you see here, and it extends all the way up until the C6. Say this is C1, 2, 3, 4, 5, and C6. Now from here, say this is the pharynx. Now from there, the pharynx terminated, and at the same time, esophagus is started. So the anterior wall, as I mentioned, anterior wall of the pharynx is deficient, and it shows that from above below that it's located anteriorly. There is an opening with the nasal cavity, and that means we know that the pharynx posteriorly closed, but anteriorly it's open with nose or oral cavity and larynx, and in the nose it's open to the nose by posterior nasal aperture, because we know this is the anterior nasal aperture and this is the posterior nasal aperture. Behind the mouth, it's open to the oral cavity. The pharynx open to the oral cavity through this opening, which is the opening of the oral cavity, and also it opens to the larynx by the laryngeal inlet, the opening to the larynx. So this is a general view of the larynx. But if we take a cross section through the pharynx, we can see that composed, yes, it's a muscular tube, but not just muscular tube, it's musculo-membranous wall. That means it's composed from muscles and covered by membrane. So let us start from here. Say, for example, you are looking to the mirror, to the oropharynx, and you take a cross section through that. The first thing you will face is the mucosa and submucosa. Then remove the mucosa. You will get a small fascia here before going or before reaching the muscle. This fascia is the pharyngeobasilar fascia. Basilar fascia because it continues, because the pharynx, the muscles of the pharynx is not continuous all the way to the base of the skull, but this deficient in the pharynx closed by this membrane that we call it pharyngobasilar fascia. Now behind the pharyngobasilar fascia, we have the muscles of the pharynx. We have, of course, two types. We'll talk about them, the circular and longitudinal ones. And behind the muscle, also, there is another fascia. That means the muscles of the pharynx located between two fascia. Most anteriorly, the pharyngobasilar, but posterior to it, this purple one, we have the buccopharyngeal that extended to the cheeks, right? That's why it's called buccopharyngeal fascia. So now, yes, we know that's between two fascia, pharyngobasilar and buccopharyngeal fascia. Now behind it there is a space. You see that red line that's located here. Now forget that there is a red line. There is a potential space. This space is the space behind the pharynx, and we call it retropharyngeal space. Retro, that means behind the pharynx. The space, the potential space behind the pharynx, we call it retropharyngeal space. Sometime because of infection, the infection can spread it there and accumulate it. We will talk about it. We call it retropharyngeal abscess. Anyway, what I want to say that behind this space, there is another fascia, which is the prevertebral fascia. This one. This is the prevertebral fascia. That means the potential space, we call it retropharyngeal space, located between the buccopharyngeal fascia and the prevertebral fascia. We call it the prevertebral fascia because it's anterior to the body of vertebrae and the muscles there, right? So this is the retropharyngeal space. Now, in this figure, you can see this is the cervical vertebrae anyway, and this is the location, potential location of the pharynx that continues with the esophagus at the level of C6, and we can see here's a pharyngeal raphe. Pharyngeal raphe, we'll talk about it, but there is the muscles of the pharynx posteriorly inserted in this ligament we call pharyngeal raphe, but most importantly here, indicating to the retropharyngeal space. This space behind the muscles, as you know, between the buccopharyngeal fascia and the prevertebral fascia. This is the retropharyngeal space. Now, again, in a cross section, although we are a little bit lower, I think, to the pharynx, but almost we can say this. This is the esophagus. Above it, you will have the pharynx, and posteriorly you have the cervical vertebra. So if this is the, say, for example, the pharynx, although this is, I think it looks like the esophagus, but anyway, look behind it, you have the buccopharyngeal fascia. That means behind the buccopharyngeal fascia, between the buccopharyngeal fascia and the prevertebral fascia, we have this space, which is the retropharyngeal space. This is the retropharyngeal space between the buccopharyngeal fascia and the prevertebral fascia, right? Somebody can say, what's this? This is an alar fascia, which is sometimes extended from the prevertebral fascia. I will show you it. Where is it? This is the, let me erase it. So again, this is the buccopharyngeal fascia, and this is the prevertebral fascia. From prevertebral fascia, sometimes it gives the alar fascia. It's in the retropharyngeal space. Anyway, the idea here that if you look to the this space, the retropharyngeal space, this space, it's bounded laterally by the carotid sheath on the right and on the left, right? This is laterally, that means bounded by carotid sheath, but superiorly, the let me erase this, the retropharyngeal space that you see here, bounded by the base of the skull superiorly. Now, what about inferiorly? It extends inferiorly to the superior mediastinum. Superior mediastinum. Now, there is extra information about that, that if there is here the alar fascia, anterior, if the abscess, for example, accumulated here anterior to the alar fascia, that means the abscess will extend to the superior mediastinum. But if the abscess located behind the alar fascia, that means the abscess will descend all the way to the diaphragm, right? So this is the retropharyngeal space. Again, I don't want to talk too much about it because already I explained it. But anyway, this is the retropharyngeal space located here, which is a potential space. Yes, it's a potential space. That means it's really for accumulation of abscess and other fluid and air and so forth. But it's, you know, a kind of filled with loose areolar connective tissue, as I mentioned, superiorly closed by the base of the skull, inferiorly, as I mentioned, laterally by carotid sheath, as I showed you before one slide. Now, the significant away from the complications and accumulation of abscess, the idea of the presence of this space behind the pharynx, that it gives the pharynx, larynx, esophagus, and trachea as well the freedom, or not freedom, the kind of a movement during the swallowing, right? So because we know that the pharynx, larynx, and esophagus, they move up and down during the swallowing. Now this is an very nice figures here. You see this is the cervical vertebrae, and just anterior to it you see this potential space. This is the retropharyngeal space, which is about, say, 8 millimeter, right? But this is the width, I mean, right? But if you look to this figure, in which you can see, again, this is the cervical vertebrae, and this is the mandible of a patient, and look at the retropharyngeal space, how it's extended, right? Look at the hyoid bone. You can see the hyoid bone, Yes, anyway, so look at it here. It's like a swelling filled with abscess and a kind of air and so forth. So this is the retropharyngeal abscess. And now moving to the muscles forming the pharynx. As I mentioned earlier, the pharynx composed from circular and longitudinal muscles. So I will start now with the three circular, or we call it constrictor muscles of the pharynx. So we have superior, we have middle, and we have inferior constrictors muscle. They are extending around the pharynx from superior to inferior, and what's interesting that all of them inserted in a fibrous raphe here called the pharyngeal raphe that of course attached above to the pharyngeal tubercle of the occipital bone and up to the pharynx down. So the if you look to the posterior view of the pharynx and the muscles, I would say the constrictor muscles forming the pharynx, superior, middle, and inferior, you will see that they are overlapping each other. That means they are look like a carton cups inside each other like this, right? So yes, so they are overlapping each other. But anyway, you would notice here because of this overlapping and because of the structure of the muscles, there are gaps between these muscles. We have four gaps, 1, 2, 3, and 4. But anyway, the gap between the superior border of the superior constrictor muscle and the occipital bone of the skull is filled by, as I mentioned earlier, by the pharyngobasilar fascia. You remember maybe the pharyngobasilar fascia. Here is the pharyngobasilar fascia that extends up to close this gap, right? Now, let us start with the first one, which is the superior constrictor. Although I don't care too much about the original session, but it's fine to show you where they originate. So the first one, the superior constrictor muscle, this one that originates from the pterygoid hamulus here of the sphenoid bone, and also from this ligament. You see this ligament, which is from pterygoid process to the mandible. We call it pterygomandibular ligament, and from the a little bit from mylohyoid line. So that's originated from there, pterygoid hamulus, pterygomandibular ligament or raphe, and it's inserted, as you see here, above with the pharyngeal tubercle and of course in the pharyngeal raphe. You will notice that all of the muscles, constrictor muscles, they inserted at the end in the pharyngeal raphe. Now let us jump to the middle constrictor muscle that originates from the first of all, you see this styloid process of temporal bone. There is a ligament from there connected to the hyoid bone. We call it stylohyoid ligament. So from the inferior part of this ligament, the middle constrictor muscle originated, and also it originates from the greater and lesser horns of the hyoid bone, and again it's inserted in the pharyngeal raphe. Let me remind you where is this is the pharyngeal raphe, sorry, the pharyngeal raphe posteriorly. Now the last constrictor muscle, which is the inferior one, and you see that the inferior one, of course, it has two parts indeed. One originated from thyroid cartilage and one from a cricoid. But for now, let us say it originates from the oblique line of the thyroid cartilage and also from the cricoid cartilage. And as I mentioned, the inferior constrictor muscle divided into two parts. The thyropharyngeal part, this one that's originated from thyroid cartilage, we call it thyropharyngeal part, and that one that originated from a cricoid cartilage because because of its name and origin from where it originates, it's called now cricopharyngeal. So you have thyropharyngeal and cricopharyngeal part. So you have two parts. If you look here to in this figure, posteriorly, this is the inferior constrictor, and look at the inferior one, the cricopharyngeal part. This is the cricopharyngeal part, which acts as a sphincter. Sphincter for what? Sphincter that prevents the entry of the air during the phases of swallowing, right? So this is the inferior constrictor, but in general the constrictor muscles, either superior, middle, and inferior, they why you called constrictor, because they are propel the pullus of the food down into the esophagus while you are eating and swallowing, right? So that was about the constrictor muscles, right? They, as I mentioned, propel the pullus of the food down into esophagus. Now, what about the longitudinal? Not the these are constrictors muscle, right? But the longitudinal, again, they are also three. One originates from the pharyngotympanic tube, we call it salpingopharyngeus, and one from the soft palate, which is originally it's apart from the muscles of the soft palate, we call it palatopharyngeus, and one comes from a styloid process and inserted there, we call it stylopharyngeus. These muscles, for their direction, they of course elevate the pharynx, and larynx during the swallowing. So they elevate the larynx and pharynx. Now, let us take another review, or the medial view to these muscles, the lateral wall of the right pharynx, the lateral wall of the pharynx from right side, I mean. So look at the pharyngotympanic tube, or what we call it eustachian tube. So the pharyngotympanic tube, from there, the salpingo, that means pharyngotympanic tube, something called related to the tube, we call it salpingopharyngeus, that means originated from the pharyngotympanic tube and inserted, as you see, blended with the palatoglossus muscle and the pharynx. This is the first one. The second one, which is the a muscle which is related to the soft palate. This is the hard palate and this is the soft palate, and one muscle of the soft palate was the palatopharyngeus. So it originates from the soft palate, from aponeurosis, palatine aponeurosis, and it inserted in the posterior part of the thyroid cartilage, and most importantly in the pharynx and esophagus. This is palatopharyngeus. So we have salpingopharyngeus, palatopharyngeus, and there is one muscle, as I mentioned earlier at the beginning of the lecture. You see the styloid process of man temporal bone. From there is a muscle. If you follow it, you will see it is, look, it's completed here. So it passes between the superior constrictor and middle constrictor. Between these two muscles, what's interesting to remember, of course, that this muscle passes between the superior and middle constrictor muscle and inserted in the posterior border of thyroid cartilage here and in the pharyngeal wall. So most of them inserted, of course, in those structures and in the pharyngeal wall, you can say. So again, as I mentioned earlier, again and again, that they are overlapping each other. Now back to the constrictor muscles, superior, middle, and inferior, and they leave like gaps, one above the superior constrictor, one between the superior constrictor and middle, one between middle and inferior, and one just inferior to the inferior border of inferior constrictor muscle, inferior to the inferior border of inferior constrictor muscle. Now these gaps are important because they allow the passage of structures. For example, the gap that's superior to the superior border of superior constrictor muscle. This is a superior constrictor muscle. This is a superior of this muscle. So superior to it, we have a gap, and in this gap, like the levator villi palatini muscle passes from there. Also, you have a space, this is space for pharyngo tympanic tube, and the ascending palatine artery passes from there between, of course, the upper border of this muscle again and the base of the skull. Now, the gap between here, between the superior and middle, it allows the passage, as you see here, the stylopharyngeus muscle, as I mentioned. This muscle of the pharynx. So from stylo, the process inserted in the pharynx and posterior part of the thyroid cartilage, as I mentioned. So this is the first one, which is the stylopharyngeus. And if you study anatomy before, you will know that this muscle accompanied by glossopharyngeal nerve. This is the friend of this muscle. So the glossopharyngeal nerve, the cranial nerve number 9, we call it glossopharyngeal nerve, innervates this muscle and passes from there. That means we have now, until now, two structures: stylopharyngeus, glossopharyngeal nerve, and also you see this ligament, which is from styloid process, not muscle, it's a ligament, which is the stylohyoid ligament. You see, stylohyoid ligament. Now this is about this gap. That means one muscle, one nerve, and one ligament. Now to the third gap, which is between the between the middle and inferior constrictor. This gap allows the passage of the internal laryngeal nerve and the superior laryngeal artery. That means nerve and artery. The internal laryngeal nerve and superior laryngeal artery. Now, what about the inferior laryngeal artery? The inferior laryngeal artery passes from here with the recurrent laryngeal nerve. With the recurrent laryngeal nerve, not internal laryngeal nerve, no, recurrent laryngeal nerve. Okay. Let us dig deep in the pharynx, and let us define the parts of the larynx. As we explained earlier, that the pharynx can be divided into three parts. The part that behind the nose, we call it nasopharynx, and the one behind the oral cavity, we call it oropharynx, and the one behind the larynx, we call it laryngopharynx. So the nasopharynx, this part of the pharynx, we call it nasopharynx, behind the nasal cavity, that communicates anteriorly with the nasal cavity through this opening. We call it posterior nasal aperture, because you know this is the anterior nasal aperture and this is the posterior nasal aperture. Now the second part, which is the oropharynx, the oropharynx communicates with the oral cavity anteriorly through this opening. This opening, we call it oropharyngeal isthmus. Oropharyngeal isthmus. Now the third part communicates with the laryngeal cavity or with the larynx through the laryngeal inlet. This is the laryngopharynx. Now let us start with the nasopharynx and let us dig deep in it and in the structures there, borders, and the relation. So the nasopharynx bounded superiorly, or you can say the roof of the nasopharynx. This is the nasopharynx, the roof of the nasopharynx, formed by the body of a sphenoid bone you see here and the basal part of the occipital bone, and beneath it you have the pharyngeal tonsils that embedded in the or present in the submucosa. This is the pharyngeal tonsils, in which when they are inflamed, sometimes they block the passage of the air passing from the nose, and especially in children, then the child shows a kind of a face called adenoid face, because it's always opening his mouth in order to breathe, most of the time breathing from his or from his mouth, not from the nose, because it's already blocked by the inflamed and swelling of this tonsil anyway. So this is the roof. What about the floor of the nasopharynx that formed, as you see, from the upper part of the soft palate? This is the soft palate. This is the hard palate anyway, but this is the soft palate, and also it's formed by the floor of nasopharynx, formed by the pharyngeal isthmus. Pharyngeal isthmus, this gap between the free margin of the soft palate and the pharynx posterior, pharyngeal wall posterior, this opening we call it pharyngeal isthmus. So this part, the soft palate and the pharyngeal isthmus, form the floor of the nasal nasopharynx. Now, anterior wall of it, of course, it's open with the posterior nasal aperture, right? And posteriorly, we talk about nasopharynx. Remember, it's against the C1, right? This is the first cervical vertebra, and laterally you are looking to the lateral wall of the nasal cavity and the nasopharynx. And what you see here, couple of structures. Let us start from this one, which is, you see an opening here, which is the opening of pharyngotympanic tube, or we call it the eustachian tube. So this is the opening of pharyngotympanic tube that's connected with the middle ear, which is a source of infection to the middle ear, causing otitis media. Anyway, so this is the pharyngotympanic tube, and this tube, it creates a kind of elevation, which is the posterior margin of it, called tubal elevation or torus tubarius. Torus tubarius or tubal elevation, created by the eustachian tube or pharyngotympanic tube. Okay, this is the opening of the pharyngotympanic tube, and this is the tube itself, right? It creates this elevation called tubal elevation. And of course, behind it, there is a recess. They are called pharyngeal recess. Now, there is also another, I would say, accumulation of lymphoid cells other than the pharyngeal tonsil. They are here close on the tubal elevation. We call them tubal tonsil. We call them tubal tonsil on the tubal elevation, right? And because of if you remember the muscle of the pharynx, that we call it salpingopharyngeus muscle, that's originated from the pharyngotympanic tube. It creates a kind covered by mucous membrane. So now it creates a kind of a fold, which is the salpingopharyngeal, not muscle, salpingopharyngeal fold, right? Because it's a muscle covered by a mucous membrane. Now we call it fold, and it creates a kind of a raise here. So these are the most important structures in the lateral wall of the nasopharynx. Now, jumping inferiorly, moving to the oropharynx. This is the oropharynx that open anteriorly to the oral cavity through the oropharyngeal isthmus. It's located, yes, the oropharynx located behind the oral cavity. It extends from the soft palate, as you see here, to the upper border of the epiglottis. This is the epiglottis, right? So this is the oropharynx. If you look in the mirror, you are looking to the oropharynx. This is the only part of the pharynx that you can see in the mirror, right? So the floor of this the roof, sorry, let us start with the roof. The roof of the oropharynx created by a soft palate and pharyngeal isthmus. So this opening again is the pharyngeal isthmus, and the floor formed by the posterior margin or posterior 1/3 of the epiglottis, posterior 1/3, sorry, of the tongue, and with the median and lateral glossoepiglottic fold, not just the epiglottis itself. There are folds and space. Let me show you where is it. So if you look to the tongue, this is the anterior 2/3 of the tongue, and this is the posterior 1/3, right? And this is the epiglottis that you see here. And the oropharynx, the floor of the oropharynx created by the posterior 1/3 of the tongue and the epiglottis, and there are folds here called median in the middle and lateral glossoepiglottic fold. These folds connected the posterior 1/3 of the tongue, glosso, and to the epiglottis. We call it glossoepiglottic fold. We have two lateral and one median in the middle. And of course, the space here called the vallicula. We call it epiglottic vallicula. So this is that forms the floor of the oropharynx. Now, the anterior wall of the oropharynx here, of course, is the opening to the oral cavity or oropharyngeal isthmus, and posteriorly it's related to C2 and to the upper part of the C3, cervical vertebral number 3. Now, if you look to the lateral wall, what you can see, indeed, if you remember from the first lecture, in the GI system, we talk about the oral cavity and the palatine tonsil, that they are guarded by folds, the palatoglossal fold, and here we are talking about the other fold posteriorly, which is the palatopharyngeal fold and arch, right? So laterally you have the palatopharyngeal fold, which is located posterior to the palatoglossal fold. In between there is a palatine tonsil that you can see in the mirror, that located in the fossa. Here is another. If you need to know more about these arches, you can watch the lecture number 1 of oral cavity, right? So anyway, this is the palatine tonsil you see in the mirror. So anteriorly you have a muscle, and posteriorly you have a muscle, both covered by mucus, so they are creating fold. The anterior one, which is the palatoglossal arch, in which a muscle from the soft palato and inserted in the lateral side of the tongue, we call it palatoglossal arch and muscle here. And posterior to it there is a palatopharyngeus, in which a muscle, the palatopharyngeal muscle, originated from soft palate and inserted in the pharynx. In between you have the palatine tonsil. So I will skip this part because this is related to the first lecture, and we'll jump to the third part of the larynx, which is the Laryngopharynx, located behind the larynx. This I will change the color now. So this blue, you can kind of a blue color extended, it's like behind the laryngeal inlet. This is the laryngeal inlet, the entrance to the larynx. Anyway, behind it you have the laryngopharynx, and it's behind the inlet and the larynx itself, extended down until it's now the laryngopharynx is the end of the pharynx and the start of esophagus, right? It extended from the upper border of epiglottis, this is the epiglottis, to the lower border of the cricoid cartilage, this is the cricoid cartilage, right? Anteriorly, it has an opening to the larynx and the upper part, but below it's related to the mucosa here that covers the larynx from the back, right? So the posterior wall of the laryngopharynx, of course, guarded by the lower border or related to the lower border of C3, C4, C5, and C6. That means 3, 4, 5, 6, the lower border of C3, just to remember that. And the lateral wall, look at the here, this is the location. You are looking to the larynx from the back. You are looking from here, right? Posterior view to the laryngo, not this, up to this level, right? Laryngopharynx. So what you can see here is the epiglottis. This is the epiglottis, and this is the epiglottis, right? And the other cartilage of the larynx. So the lateral wall of the laryngopharynx, guarded or supported by thyroid cartilage. You see here, thyroid cartilage here, and this is the hyoid. That means this membrane between the thyroid cartilage and hyoid bone, we call it thyrohyoid membrane, right? So this is, you know, the lateral wall of the laryngopharynx here in the back. And of course, on each side of the laryngeal inlet, this is the laryngeal inlet, on each side you have this fossa here. Again, let me erase what I meant here. So this space, my friends, this space is we call it Piriform Fossa. What's the piriform fossa? Indeed, the piriform fossa is a small depression, as you see here on either side of the laryngeal inlet. This is the entrance to the larynx itself, then from larynx to trachea anyway. So on each side there is a gap here. There is a space, not a gap. Or fossa. We call it piriform fossa, right? So um, indeed, it leads obliquely backward and downward from the back of the tongue, as you see here, to the esophagus, and it's a common site for loading of foreign bodies. For example, some people or child, for reason or another, swallow like foreign bodies, so sometimes it's lodged here in this fossa. So when you try to take it out or remove it, sometimes it causes a kind of injury to nerves there. Yes, there are nerves, as you see in the figures, located in this fossa, just covered by mucosa, so they are liable for injury. Now, this fossa, of course, you will get more details in the respiratory system. But let me show you the border of piriform fossa, in which medially formed by airy epiglottic fold from arytenoid cartilage here, and this is the epiglottis. So there is a membrane. This membrane between arytenoid cartilage and epiglottis called epiglottic fold. This is medially. Laterally, they are guarded by the lamina of the thyroid cartilage on both sides and thyrohyoid membrane. As I mentioned earlier, from thyroid cartilage to hyoid bone. So this is the lateral border. That means this fossa here is the piriform fossa. So clinically, as I mentioned, if you swallow a foreign body, sometimes it lodges here in this space, and when you try to remove it, you get injury to internal laryngeal nerve, as you see here, and recurrent laryngeal nerve, right? They're located here, right, in this piriform fossa, just covered by mucosa, and they are vulnerable to injury during the removal of foreign body. Innervation of the pharynx, which is pretty easy. We can divide it into sensory nerve supply. That means the sensation from the pharynx, and the motor nerve supply, which is the nerves that innervate the muscle in order to contract and so forth. So, the pharynx is three parts. In order to memorize the nerves that carry sensations from the different parts of the pharynx, I would remind you with this. So from nasopharynx, the sensation carried from there by maxillary nerve V2, right? So the sensation from nasopharynx will be through maxillary nerve. Remember that the nasopharynx behind the nasal cavity and the maxilla, so close to the maxilla, I mean. So it's the sensation from the V2. Now the oropharynx, the area of oropharynx, the sensation from there through the glossopharyngeal nerve. How can you remember that? Remember that the glossopharyngeal nerve passes from here and to carry the sensation and taste from posterior 1/3 of the tongue. That means close to the in the oral cavity. That means, remember, cranial nerve number 9, glossopharyngeal nerve. Now, what about the lower part of pharynx, the laryngopharynx? From the internal laryngeal nerve of the vagus nerve, right? So these are the nerves carrying the sensation from the parts of the pharynx: maxillary, glossopharyngeal, and vagus nerve. Now, let us move away from sensation into the motor nerve supply. These, the muscles that form the, you have the 3 constrictor muscles, the circular, and 3 longitudinal. So the innervation, let us say that all muscles of the pharynx will be, except of course the stylopharyngeus, all of the muscles are innervated by pharyngeal plexus. Now, which part of the pharyngeal plexus? Because pharyngeal plexus formed, it's a network of nerve fibers, right? So it's formed by glossopharyngeal nerve, vagus nerve, axis nerve, and sympathetic, and so forth. So there are a couple of nerves exactly from the pharyngeal branch of vagus nerve. That means the vagus nerve innervates all muscles of the pharynx except the muscle that known as stylopharyngeus. Why? This is the stylopharyngeus muscle, as I mentioned in the previous slides, that this muscle accompanied by a friend, a nerve. Here you see this nerve that passes with it, accompanied with it, and it innervates it. So this muscle innervated by its friend, which is the glossopharyngeal nerve. So yes, it has the priority to be innervated by this nerve, which is the glossopharyngeal nerve. Anyway, so let us remember that all muscle of the pharynx, except the stylopharyngeus, innervated by the pharyngeal branch of vagus nerve, right? So already had this one, the pharyngeal plexus, already explained in the previous lecture, but let me show you that this is the superior constrictor muscle, middle constrictor, and inferior constrictor muscle of the pharynx. And you know that these, you look at the plexus here called pharyngeal plexus because they are located mainly lateral to the wall of the pharynx, exactly, mostly lateral to the or outer wall of the middle constrictor muscle, formed by the glossopharyngeal nerve, cranial nerve number 9, vagus nerve number 10, and cranial part of accessory nerve number 11, and part from the sympathetic system passes to the plexus through the superior cervical sympathetic ganglion. They all created a kind of pharyngeal plexus. Now from there, mainly the branch that come from the pharyngeal branch of vagus nerve that innervates the pharynx, but of course through the pharyngeal plexus. Anyway, so the blood supply of the pharynx, which is already you are familiar with, in which it's supplied by the maxillary artery plus the facial artery that gives the ascending palatine artery, and you have the lingual artery and the branch, not just the ascending palatine but also the ascending pharyngeal artery from external carotid artery. These vessels, maxillary, facial, lingual, ascending palatine, and ascending pharyngeal, all they supply the pharynx. And what about the venous drainage? Indeed, the veins in the and around the pharynx create a kind of a plexus. Then the blood from there around the pharynx drains superiorly into pterygoid. You see here the pterygoid venous plexus in the infratemporal fossa, and inferiorly into the facial vein, right? And ultimately into internal jugular vein. So, pterygoid plexus, facial vein, internal jugular vein. Now, what about the lymphatic drainage? Yes, lymphatic drainage would be the closer ones here to the deep cervical lymph nodes you see here. So, either directly to the deep cervical lymph node or indirectly through another node like retropharyngeal nodes behind the pharynx. We call them retropharyngeal nodes, or through the paratracheal lymph nodes, and from there to the deep cervical lymph nodes. So clinically, as I mentioned when we talked about the nasopharynx, you have the pharyngeal tonsil that's located in the mucosa here in the roof of the nasopharynx. Sometimes it's enlarged, and causing like, so what we call it, adenoids that sometimes blocked the respiration from the nose, in which, for example, in this figure, you see this guy has this face with an opening, with an open mouth, right? This face, we call it adenoid face. We call it the typical face, which is the adenoid face, because this is like, it becomes like habit, because he has to open his mouth, because the only way to breathe is to open his mouth, because the inflammation and the swelling of the pharyngeal tonsil up in the roof of the nasopharynx, and the breathing almost like stopped and blocked from the nose. So the only way is to breathe from the mouth. Then by time the child or the patient has like this face, which is, we call it adenoid face. And sometimes also, as we are talking about the nasopharynx, and we know that there is an opening for the auditory tube or pharyngotympanic tube, or we call it the eustachian tube, that connects the nasopharynx to the middle ear, right? In which to equalize the pressure on each side of the eardrum. So because the excess of this tube opening in the nasopharynx, and because of the infection sometimes can spread from here, from the pharynx to the middle ear, this leads to inflammation of the middle ear. That means the infection will be spread from the pharynx through the eustachian tube or pharyngotympanic tube to the middle ear, called something related to inflammation of the middle ear. We call it otitis media, or middle ear infection. Also, it's common, the tonsillitis, inflammation of the tonsils, which is very common. Sometimes it creates a kind of the sequence of the inflammation is the accumulation of the abscess in the peritonsillar area. Piriform Fossa already we explained before, maybe 7 or 10 slides. You can go back and read the clinical correlation to it, especially as I mentioned, the site for lodging of foreign bodies, and what's the complication when you try to remove the foreign body is to injure the recurrent laryngeal nerve and internal laryngeal nerve there. That's just covered by mucosa. Pharyngeal pouch, because we talked about the superior constrictor, middle and inferior, superior constrictor, middle and inferior constrictor muscle, and we mentioned that the inferior constrictor muscle has 2 parts, one attached to thyroid cartilage, you see here, and one attached to cricoid cartilage. So this is the thyropharyngeal part, and this is the cricopharyngeal part, and between them there is a gap, so sometimes the mucosa there can be herniated outside posteriorly and creating something called pharyngeal pouch. The pharyngeal pouch lead to a kind of difficulty in swallowing, right? Called something, what we call it, dysphagia, right? Difficulty in swallowing and also in breathing. So mainly it occurs in older people. Now the retropharyngeal abscess, we talked about the retropharyngeal space and abscess at the beginning of the lecture. You can go back and have a look. So thank you, my friends, and hope you find value in it. Thank you.